There we go. All right. Just want to say once again, welcome everybody. Can't believe it is October 18th and we're already thinking about fall 2024. But it is amazing that we're all here. This is the UCLA School of Nursing for those that are interested in our PhD program. My name is Mark Coven. I am the Director of Recruitment, Outreach, and Admission here at the UCLA School of Nursing. And the purpose of today's session is to go over our post-licensure program. Of course, everyone here has their nursing degree, the RN license. They may have a master's or a BSN, and that's totally fine. We do have different tracks for you guys. And so we are excited to talk about those. Of course, as you guys know, we use all acronyms here at UCLA, right? UCLA, University of Los Angeles, California. We do the same thing here in the School of Nursing. So of course, the PhD is our Doctor of Philosophy. Okay, so we're going to go over the agenda really fast. We hope to get you out of here before 3 o'clock. We promise to do that. I know we have other things in our life that we have to attend to. And then we'll also try to, kind of stick to this schedule as well. So I'll finish up with the welcome, and then Dr. Wendy Robbins will talk about the school's mission, focus, philosophy of the program, and then I'll go over the application process. And then we have a really short video, but very informative video from our Director of Financial Aid. Her name is Leonie Thomas, and she's amazing. She'll go over the scholarships, how to apply for them, FAFSA loans, the university fees and tuitions, and so forth. We'll take a quick pause if we need to answer any questions, maybe a stretch break, whatever the case is, and then we'll go ahead and finish that up with our faculty research and clinical expertise panel. Just for a side note, we are in the midst of recording a student panel, so that will be happening, I believe, later this week. We'll record it with our current students and or our recent grads, and then we'll make sure to put that on our website as well. So I'll make sure to send that to those that are joining us today, as well as those that may be interested as well. Okay, so why UCLA? Right? Okay, I know for those that are here, you don't really necessarily have to hear me say why UCLA, but the university does provide a lot of things that we hope intend to be, pillars for your success. But one of the examples I like to use is the small community within the big city. Again, you guys are used to or have been on the UCLA campus, but if you remember or may not remember, UCLA in itself is its own small community inside the big county of Los Angeles. And so on campus, we have UCLA Health, which is the Ronald Reagan Medical Center, right? Yay, #1 hospital on the West Coast. I know we've been that for several years now. And so we're really excited to, again, still have that on our campus. Of course, we have our own police department, right? So safety is always the #1 thing when it comes to campus. If you guys remember, we have Rouse, which is probably one of the biggest grocery stores I know I've ever been to. I know years ago, it used to be like a Best Buy and then a Rouse, and they combined them together. And then now it's like this huge compound. So, we have that. And then, of course, as you get into Westwood, we have all the, best places to eat, to hang out, to shop, and so forth. And so UCLA offers everything, right? And so, okay, what does that mean in terms of like the School of Nursing, right? So let's kind of flip it around in a sense. And so in the School of Nursing, we offer tons of resources for our grad students. Again, as I mentioned, Leonie Thomas as our Director of Financial Aid, there's not a lot of departments on campus that have their own financial aid office. And so that is something that we're really proud about, and that knowing that Leonie pretty much knows all students' names and will ensure the best that she can, right, to provide, the best assistance in terms of, getting scholarships. If it's before the program starts, the middle of the year, it could be your last quarter, wherever the case is. She's amazing. We also have a mentorship program that we've, put together. It's still the same for our doctoral students. Well, we will match you up as you enter your first year. We'll match you up with, a student who is getting into year 2. And we just want it to be, one of those instances where you're already going to have a friend, right, at the doctoral level, but that person, can pass down some ideas, some study habits, what professors maybe tougher than others, or pass down some books or things like that. So the mentorship, we find some really good value with that. Of course, you're going to have your faculty advisor. You're going to also work with Dr. Farnar Sadat, who is here with us in the Student Affairs Office. She ensures that you're going to be matriculating and moving forward. We have, tons of other things I can keep going, and that's just within the School of Nursing, as well as us partnering with, the university and the campus for other things and student needs, right? And so I think because of that, we have been and continue to be recognized as one of the top nursing schools, along with, right, our esteemed faculty and our professors that are here with us, as well as the best teaching hospitals and where you can also do your research. So again, U.S. News and World Report are the ones that say we're great, right? Of course, we feel it, but it's good to know that we are getting that recognition as well. Okay, so without further ado, I would want to pass this over to Dr. Wendy Robbins, and she's going to give you an introduction of the school as well as the program. Take it away.
Okay. Thank you, Mark. I can take the next slide if you're so kind. Okay. So, everybody tends to start with the vision and the mission. And so for our School of Nursing, the vision, we lead, we transform nursing science. And the PhD program is all about nursing science, how nursing is taught and how nursing is practiced. And for those of you who might want to go into academia, we do prepare you for teaching in nursing schools as well. The mission, improve the health, wellness, quality of life, and nursing care of the people of California, the nation, and the world through education, research, nursing care, and community engagement. And so the next slide. So a quick overview of our PhD program. The program is set up as a 4-year program of study for most students, but some students graduate in 3 years, some students take 5 years, and life happens. Some students take more years, but the way that we focus it is around a 4-year program that then you individualize with your advisor to fit you. Our program is aligned with the 2022 AACN Pathways to Excellence statement for the research-focused doctorate. We also offer a DMP at UCLA, but this is the research-focused doctorate. And there are very few PhD-prepared nurses, less than 1 in 1,000. You are at the highest level of academic preparation in nursing with the PhD. So I kind of alluded to this earlier. We graduate and develop our graduates to prepare them for the science of nursing and also to steward the discipline of nursing. Science of nursing is the research piece you're prepared. Steward the discipline is all that goes along with keeping nursing thriving and teaching the next generation of nurses. You will be taught and mentored by leaders in the field of nursing, and at a top-tier research university, UCLA brings in more than $1.7 billion in research funds each year, and those resources, those research labs, research leaders, those resources are available to you at UCLA. We also have a highly individualized program of study. That means we meet you where you are when you come in. We look at what you've already done, what you already know, and then we go from there to allow you to master the program so that it fits you. Okay, next slide. Okay, so just a bit about some of the faculty who could possibly be mentors for you at UCLA. So we talk about brain-body connections. There is a group of faculty who use brain imaging, and they look at different things. For example, self-care for diabetes. They look at how those two things merge. We have a strong cardiovascular research group. Holly Devon will join us later today and talk about her new NIH-funded study related to cardiovascular health. We have a very strong cadre of data science professors. So if that is your interest, you will find a mentor there. Environment, work, and health. Also, we have a relatively large research group, about 5 to 10 students, PhD students, looking at environment, work, and health. And myself and John Lee mentor most of those students. HIV/AIDS plus other infectious diseases. Wee Chen will join us later. She does research around the world in HIV/AIDS, and she can talk to you about her research. And healthy aging, Young Soo Song, Sophie Sokolow. They look at pharmacogenetics is Sophie, and she looks at Alzheimer's, and that is she's a great mentor. Young Sue is a fabulous mentor. She looks at sleep and aging. Let's see, mental health. Kristen Choi is a strong researcher here. Felicia Hodge will join us later to speak to you about her research. And then social determinants of health. Kia Jeffers is a strong researcher here in that area. We have many in that area. Vanessa Salem will join us later to talk to you about her newly funded research in that area. And then tobacco and smoking cessation. Mary Rezcana is a faculty known nationally, American Heart Association. She does a lot of work with them. So next slide. I think pretty much you can find a mentor in the area of your interest at UCLA. If you take a look at the website and the faculty on that website and look at their research, you can reach out to them. If one of them's not, in the panel later on, even them, you can reach out to any of us, and we'll welcome you to talk with us about what you plan for your research and how we might be able to help you. So basic overview of the curriculum. This is my last slide, I believe. You start year one. Year one has a lot. Year one gets you ready for everything else. There's a philosophy of science course. There's a course that it talks about theory and concept development. Health equity and ethics are woven throughout. You start your statistics courses in year one, and then you get an intro to qualitative research. And all of this time, you're doing a course on nursing science. That is, what is the state of nursing science in the area you want to study? And so the faculty will lead you through that. Year two, well, after year one, you take a written qualifying exam. And then after the written qualifying exam, that's in the summer, you start year two and you get research methods courses and research design courses, and both qualitative, if that's what you're interested in, or quantitative. And these are more advanced courses compared to what you had in the first year. And then there's a grantsmanship course. At this second year time point, you start thinking about who you might want on your dissertation committee. And then you work with your advisor and select people who you might want to have on your dissertation committee. And then in year three, you form that committee and you prepare for your oral qualifying exam. And that can happen at the end of the second year, or at the end of year three, or more toward the beginning. Depends on where you come in the program, where you'll be at that time point. Remember, individualized for you. And once you pass your oral qualifying exam, once you pass it, everybody most likely passes it the first time. But once you have that check mark on your checklist, you can begin your dissertation research. And then year 4, you complete that research, you write your dissertation, and you have your dissertation defense. And then you graduate with your PhD. That's how it's set up as a 4-year program, but like I say, it can vary a bit per person. All this time, you see the big arrow, blue arrow on the right? All this time, you have an advisor at the beginning, and you get mentoring, and then you get hands-on research experiences, and then you get specialty experiences through cognates, or your advisor may find a lab for you to get those experiences. Once you get past your written qualifying exam, you put together your committee, and then you are assigned your committee chair. Once you have that committee chair, that can be your advisor or someone else. Then from that point on, it is that committee chair who guides you. And then let's see, next slide. Yeah, I'm finished, but do you have questions at this point? Okay, when the research panel forms at 2:15 p.m. and people talk about their research, if you've thought of questions by then, I'll come back at that time too. And you're welcome to contact me anytime. Would love to hear from you.
And before we continue, I actually have a question I would like to ask, and then maybe this would help the group. When you are forming your committee, could you let them know how many faculty members are part of the committee? How many are supposed to be part of UCLA? Can we have anyone outside? Maybe kind of a little breakdown on that?
Sure. So the committee has 4 members. Your chair is the only member that has to be faculty in the School of Nursing. All of the other members can be in nursing, or they can be in other disciplines as well. So if you're working with a researcher, some students are coming in working with a researcher, let's say maybe at Santa Monica Hospital or someplace, and they want that person to be on the committee. That person could be on the committee if they are faculty at UCLA. They count as one of your 4 members. If they aren't, then they count as an additional member on the committee. But you could find a mentor, for example, in public health. You could find a mentor in medicine. You could find a mentor in social welfare. So the only person who has to be in nursing is the chair. And I should mention that our courses are, that first year of courses and the second year, some of them are offered remotely, some in person. And when they're offered in person, we try to cluster them on one day. So if you're far from campus, you only need to get here one day for those courses. Yeah, so I hope that helps. Just remember, top-tier research university, teaching and mentoring by leaders in the field, and individualized program of study that meets you where you are when you enter. Okay, I'll come back at 2:15.
Wait, I think Martha has
ask one quick question.
Yeah,
sure.
Are there any courses the last 2 years, or is that mostly just doing research?
That's mostly doing your research.
Okay.
We have a requirement that you take what we call cognate courses. And those are courses that aren't necessarily in the School of Nursing. In fact, they're out of the School of Nursing. But it's for you to get depth in your area of interest. And so many students will take them in year 3 or in year 2. Year 1 is pretty dense. Year 2 is lighter. And year 3, you take independent studies mostly, or other courses to help you get depth.
Thank you.
And Charlotte?
Yeah, I just had a question about TAing. So, do you have credit opportunities for TAing, and how early do those generally start in the PhD program?
Okay, for PhD students, TAing can begin in year 1. In fact, most of our PhD students will take the required course for campus to become a TA. We offer it through the School of Nursing, and they'll take that either fall or winter. You don't have to, though. I mean, some people like to TA right away, some people not so much. And some people don't ever want to teach, you know, they want to do research or policy or something like that. The other thing is, in terms of TAing in the School of Nursing, PhD students have first choice. They get the positions first, and then if there are remaining positions, then they go to you know, the APRN students or the MECN students to TA for the undergrad.
Thank you so much.
And really fast with that, Charlotte, too. Hopefully, Leonie speaks about it in her recording. If not, she'll have her contact information. But TN is also another way, right, to help pay for, you know, the tuition and
Right.
whatnot. So, especially the last 2 years. So,
Right.
she'll go over the opportunity of really, you know, fully getting your doctorate without having to pay for any of the years throughout the 4 years. So it's pretty amazing. But that's what TA can also do for you.
Yeah.
Yeah,
And
thank you.
it's great to see you here, really. And I'll come back at 2:15, right, Mark?
Yes.
Okay.
Awesome. Thank you. Okay, so I will continue on with the application process. Some of you guys are familiar with it, especially for the grad students. But if there are some that are going to be applying for the first time, I'll definitely make sure to kind of go through this. Please raise your hand, unmute, whatever you have to do. If you have questions, please let me know, and we'll continue moving forward with this. For those that may be interested in applying for fall 2024, the application is now available. Yay! It became available almost 3 weeks ago, maybe, yeah, about 3 weeks ago. And so you will be able to locate the application through UCLA graduate admissions. And so to locate it, you would go to grad.ucla.edu. There are 3 application types. So when you start the application, so we're going to do the username, login, password, and all that sort of stuff. It's first going to ask you, what are your plans for graduate study, right? So it's going to say, hey, application type. There is an option for new. So new would be for those that are applying for the first time for graduate study. Readmission would be for those that have a graduate degree already. So I'm seeing some faces on here. So it means if you have a master's degree, if you have something else in terms of a graduate degree, you would be actually applying for readmission. Okay. Renewal would be for someone who applied for grad school, was admitted, but did not start. Okay, so typically I think the people on this call, or for those out there who will be listening later, you would either be new or the readmission if you are a UCLA graduate already. The next important part would be the major/program. So this is also just as important, making sure that you're going to be selecting the correct major. We have different grad programs, as you guys know. We have a nursing MECN, which is our MECN. We have our nursing APRN. We even have our nursing DNP as well. And so you want to make sure that you're selecting that nursing PhD. By selecting that, it's then going to transfer you to the right application. So we're going to go ahead and select nursing PhD. And then it's going to say, hey, we're going to need you to complete the academic and transcript section. Again, you're going to want to input in chronological order if you can, your highest education, right? So we'll be going from our master's degrees, if we have any, and or our bachelor's degrees. So you're going to be able to look up the school, it's going to populate it, and then it's going to ask for you to submit your unofficial transcript. For those in the past, you were probably thinking, well, at that time, they didn't ask for unofficials. We had to send our official transcripts. Good thing now is you get to submit or upload your unofficial transcripts, so you get to save yourself some money at the time of application. Once admitted, we will ask for you to submit your official transcript. So that's where the university gets to confirm from what you submitted in terms of your unofficial is correct. And so universities are now offering electronic official transcripts. So if your institution has that, we can accept those. And or if they only send snail mail, it's weird how we call it snail mail, but if it's hard copies, they can send that to us as well. One thing, if you are a UCLA graduate, good thing is you don't have to spend any money on your official transcript. My office, we have internal official transcripts, so we will know that, we'll make a note, and we will, on our end, be able to grab it and then upload it to UCLA Graduate Division. So good thing with that for your UCLA transcripts. If you went somewhere else for maybe your undergrad, you would still have to request that official transcript. Okay, so there's going to be 2 essays that UCLA Graduate Division requires for applicants to submit. The first one is going to be the statement of purpose. Okay, so in the statement of purpose, what they want you to do is really provide and demonstrate your abilities to basically to express clearly, which we all know should be required of someone applying for graduate school. But with that, for the statement of purpose, it's going to be up to 1,000 words. You will be able to, I think it says cut and paste, but I think now you should be able to complete your statement of purpose on via Word, and then you should be able to upload it into the application. But there are some key bullet points in terms of what they want you to talk about for your statement of purpose. So the first one, of course, is your reasons for graduate study. Okay, so this may not be, again, your first time applying for graduate study, but it's going to be basically your reasons for wanting to enter a PhD program. Okay, so you definitely want to talk about that. Also, we're going to want you to include, your background, your training, and any experience that you believe is relevant, right, towards your doctoral study. Okay, so that could be educational, that could be also the work that you're currently doing, working as a nurse, and or if you maybe even possibly have some research experience. That's what you're going to want to talk about as part of the statement of purpose. If we were to move on to the second kind of part, it would be, again, talking about your personal characteristics, right? And so include your strengths, of course, your weaknesses and areas that you think you can improve, right? And then you also want to talk about how these characteristics have influenced you as an individual, as well as group interactions, and just also emphasize like your personal or interpersonal style, right? Leadership. Again, you guys all know how important leadership is here at UCLA and the School of Nursing, and how we have that woven in pretty much through all of our programs. We also want you to talk about any problems in nursing science. So this is where you're really going to be wanting to focus on what your research interest is, right? And so the questions 1 through 3, you can kind of keep them brief because, again, it's only 1,000 words. But this part in terms of 5, 6, and I believe 7 is where you're really going to want to talk about, again, why you want to enter a doctoral program. And so that's where you're going to talk about your research interests. Before I forget, and I know Dr. Robbins mentioned it before, but if you have, or if you have an idea, well, let me say this. You should have an idea already of what your research interest is. If you have or have not looked up some of our faculty members, they may have a similar research interest to you. I would recommend doing that if you haven't already. The reason for that is, 1, you want to be able to hopefully have a mentor already in mind for someone that may have the same research interest as you. So you want to be able to talk to them about what your research is, and then they can give you some pointers, some ins and outs and things like that in terms of how that can align with UCLA. With that, you can also talk about that in your statement of purpose in terms of how you've already reached out and spoke to one of our faculty members and how they can help you move towards your research interests. So I definitely wanted to talk about that before I forget. Also, number 6 is saying, why are you selecting a PhD program here at UCLA? Again, so what is it about UCLA, right, that is going to be able to afford you that opportunity to continue your research and get your doctorate? And then also what contributions as well, right after, completing and receiving your doctorate degree. Do you want to continue with that research? Do you want to do teaching, right? So it's really just giving us an outlook in terms of what you want to do once you get your doctorate degree. Okay, so that's actually number 7, right? So again, sorry, that's really talking about and facilitating your career goals. That's really important for us as well as our faculty members, just to ensure, again, that we would be a really good match for you. Okay, and here's number 8. Sorry, I just wanted to make sure I didn't forget, but that's basically what I was saying before, is if you haven't already, check our website. I can make sure to put that in the chat, and or you will be able to speak to, I think we're gonna have 4 or 5 faculty members coming to the research panel. And they will talk about this as well. It's just really, if you can, reach out to someone who could be a potential advisor. It's really going to be helpful as you go through the application. And then you'll see in one of the next slides, we also have an interview process as well. So that's really going to be key, is if you can, telephone, Zoom, face-to-face meeting with them. And I think that will also be important. Okay, so then there's the personal statement, right? And so, of course, we don't want the statement of purpose and personal statement to be duplicated or basically have the same information, but there can be some overlap, right? And so I always kind of preface it this way. The statement of purpose is your why. Why do I want to apply to a doctoral program? Why is it UCLA? And then again, what I want to do with it after. Whereas the personal statement is really more about yourself, right? And your life experiences. Okay, so it, of course, include educational, personal, cultural, economic, social experiences, academic, whatever the case is in terms of where you've been and what you've done thus far. And again, how that has helped prepared you for graduate study. Okay. Again, we've all applied for, either, nursing programs or grad school. But the difference here at UCLA, as you guys should know, is that we really want to see another side of you, right? We're not just like, hey, what is it about getting your doctorate, that is inspiring and passion of you, but we really want to know more about yourself as well. So as you guys know, we really do care about that right there. And then also lastly, if you have any contributions to diversity, of course, right, knowing how diverse the campus is, UCLA is, the city and so forth, we want you to also talk about that as well. The difference between the statement of purpose and personal statement, unfortunately, personal statement is only 500 words. So it is a little bit shorter. I do believe the statement of purpose, if it's 1,000, it comes out to be about 2 or 3 pages, I believe, where the personal statement, 500 words, I believe if it's single space, it's probably a page. I will also give you this little insight. We're not sticklers on it, to be honest. It could exceed the 1,000 words. It can exceed the 500 words. We want you to put everything down. We don't want you to have to take things out because you're like, oh my gosh, I have to adhere, by this word count. Okay, so don't necessarily worry about that. Just really put everything that you can down, and our faculty are not sticklers on that. Resume, we'll go through this fast because you guys know how to write a resume. You guys know what to put in your resume. My biggest thing is that it doesn't have to necessarily be like a work resume or CV where it's like, it's just 1 page and I have to cram everything I've done in my personal and or professional career into 1 page. For us, it can exceed that, right? So it could be typically someone would submit a 2-page resume. It could be 3, it could be longer, especially if you maybe have done some research already, you have some publications and whatnot, right? And of course, we want you to put that in your resume. So the biggest thing is you just want to make sure that you're going to highlight all of your educational, as well as the honors received, of course, work, volunteer, professional organizations and associations. So just, again, do not leave anything out, right? I always say, and I know our faculty say, we don't care if it's the smallest thing to you, it really means a lot on our end.
Mark, can I ask a question about that? So I know, because like classically the format of resume versus CV is different. Is there, are you looking specifically for a CV, or is it either or, kind of?
No, it's a great question. Yeah, it's either or. It's either or. We're not sticklers on this. This is also another way for the applicant to be creative. and how they put one together, and or what they feel works best for them. So yeah, either one is fine.
Okay, thank you.
Yeah, of course. Okay. Oh, so here we go. So just some other things that you would want to list, right, if you can. So of course, the positions that you hold thus far as a nurse, if you have any professional certifications, again, organizations, activities, associations that you belong to, community, public service. Oh, sorry. Okay, there we go. If you've been invited to lectures, right? So again, put everything down. This really does give our faculty another insight. As you guys know, you'll be able to list some bullet points in terms of what they are, right? So if I was invited to, so-and-so lecture, this is what it entailed. This is what I had my presentation be on, and so forth. Okay, so let's talk about the letter of recommendations really fast. For our letter of recommendations, you guys should know again, but again, it works a little bit different from maybe other universities where it's like, hey, you're just going to ask your recommender, can you write me a letter of recommendation? They send it in and then boom, it's done. Not for us in the UCLA School of Nursing. When you get into the application, you will have the opportunity to add 3 recommenders to your application. You're going to put their name, email address, and they may even ask in terms of what their title is. You'll go ahead and add them. Once you add them, they will receive, and it should happen in a matter of minutes, they will receive an email from UCLA Graduate Division. So it won't say specifically from the School of Nursing, but it will say from UCLA Graduate Division, and it will say to the recommender that they have been selected to write a letter of recommendation for applicant A. It'll be a link for them to click on, and the link will actually direct them to the School of Nursing recommendation form. Okay, so in the form, it's really fast. It shouldn't take the recommender more than 5 minutes to complete, but it will be questions that are drop downs, and they will be able to check off things. Okay, so questions could be, how is their writing ability? It's excellent, outstanding, average. How is their oral expression? How is their leadership? It's excellent, outstanding. They're very short, quick, hopefully not super thought out type of questions to where your recommenders are gonna, have to spend a lot of time. There should be another maybe 2 or 3 questions where they will be able to type in answers. So that will be something that they can do. But then there's also an optional letter upload as well. Okay, so again, that's where that traditional letter comes in, where if they have one written or if they want to write one, they can do that as well. So they will have the option of uploading a letter. We do ask that each recommender submits the actual form. For any reason, because sometimes this happens where if they already have a letter, they're like, hey, we don't need to complete the recommendation form. We will check, and then we will get back to them saying, hey, thanks for submitting that optional letter, but we will ask for you to also complete this recommendation form. Again, before I forget, as you're going in and you're selecting your recommenders, you're putting their name and email address, it's going to ask you the recommendation form type. Okay, this is where you want to make sure that you're selecting nursing PhD. Okay, because again, we have different grad programs. So we have a separate recommendation form for our MECHAN program, a separate one for our APRN program, and I believe also for our DNP. So you want to make sure that you're selecting nursing PhD. That's going to be the actual correct form for them to complete. Of course, you're seeing already on this tab what type of recommenders you can use. So of course, any professionals in a supervisory or educational or mentoring relationship that you have. Of course, we just ask that there are no family or friends. Any questions on that part in terms of kind of how the letter recommendations work? Maybe who I should be asking. If you guys already have someone in mind, I can take a quick pause just to see if you guys have any questions on that.
Do we have to have somebody that was a professor of ours, or like is it recommended to have somebody who was a professor of ours?
Yeah, it's a good question. No, it's not. Okay, let me actually say it this way. Well, first answer is no. It's not required. Recommended, not necessarily. I always go about it this way. Choose your best three. That is what I always say. Choose your best three. If you are making a list 1 to 5 and professor is number 4, or professor is number 5, they don't make that cut for the top 3, that's totally fine. The reason why I say that, and I know our faculty will back me up on this, is because we want you to put your best application forward. The relationships that you have, if it's supervisors or a mentor or whatever the case is, if those 3 come up first before someone that is in academia, that's fine too. We just want you to be able to select 3 people that know, of course, a doctoral degree is your career goal, right? Is your next step. I mean, they'll be able to talk about that, your potential success as well. So I always tell people any combination. It could be all 3 professors, right? And no supervisor, whatever the case is, but yeah. Okay, so let's talk a little bit about the supplemental prerequisites. Sorry, I'm going to do this here. Just give me a quick second. Okay. All right. So for the prerequisites, as you get into the application as well, it's going to have a prerequisite dropdown where it's going to say, please list the prerequisites that we require and if you've completed them or not. With that, there are going to be 2. It's going to be your biostatistics course, as well as a nursing research. So again, if you have your MSN already, we're going to be asking for a graduate level nursing research. If you are a BS to PhD, your undergraduate research course would also be sufficient. For the biostatistics course, we have it if you guys completed Biostats 100A or the Biomath 170A. Anything equivalent to that would be okay. The only issue here is that it has to be done within the last 3 years. So I will say majority of our applicants and students admitted to our program will have to retake biostatistics. That's okay. Of course, you can still apply with this prerequisite outstanding and wait until you hear back from your admission to decide if you want to take it and or when, I should say. Typically, admitted students will end up taking this course in the spring and or summer. I say that to say, and it might be one of the next slides, typically applicants will find out their admission status in the month of like February. And so again, knowing that the program starts in September, you have several months to complete this course. We do have a list of approved courses on our website to where if you did want to take this course, or if you have to take this course, there is an online option through UCSD Extension. So University of California, San Diego Extension. I'm blanking on what that course number is, but I can definitely get that to you, but it is also on our website. That is one of the prerequisite courses that majority of our admitted students take. It's going to be through Extension because it is offered online. Nursing research, no time limit. So of course, what we'll do is we'll just look through your transcripts to verify that you have a passing grade of C or better. What you're also seeing here is we will need a status of your RN license. So it could be any state license here in the state of California and or your home country. That's totally fine. You will just have the opportunity to upload your status of your RN license into the application. If there are any international applicants joining us today, you will be required to take either the TOEFL or the IELTS. If you did graduate from a foreign university where English is not the primary language, you do have the option again of taking TOEFL, which is, I believe, internet-based, and you would have to score it at least an 87. or the IELTS, which is a 7 or higher. What you're seeing here is if you do decide to take the TOEFL, you're seeing the institution code, which is 4837, as well as our intended graduate major code 0610. And what that does is you'll enter both of those codes, and then we will receive the scores directly into your application. Okay, so as I mentioned before, once you submit the application, again, with your statement of purpose, your personal statement, letters of rec, resume, and so forth, it does get reviewed by our faculty member. Your application will get reviewed twice, actually, by 2 different faculty members. They will review your application, they will score it, and then we will have a almost like a mid kind of term, mid admissions meeting to determine who will move forward for the second phase, which is the interview. So we basically call it the second round, which is going to be the interview. And so again, what we will do is we will select those that we want to move forward with that. And then we will conduct a Zoom interview. We thought it's the easiest for applicants. In the past, we've had to be face-to-face, especially when this was before the pandemic. It was very tough for people to come to campus. And so now everything's been via Zoom. Typically, it lasts about 30 minutes or so. And really what it is just having a focus and a discussion, right, to kind of verify and talk more in depth in terms of what your doctoral studies and your plans are here at UCLA. The interview will consist of 3 or 4 faculty members. One is going to be the Student Affairs Committee, SAC Committee Chair, and then it will also consist of other faculty members, either in SAC and or the program director is Dr. Randy Robbins, or potentially maybe that faculty advisor as well. So again, you may be in an interview with about 3 to 4 people. And then once the interview is concluded, typically we try to get back to applicants. Again, as we are getting and rounding about into the month of February, they typically find out about a week or so after in terms of the admission decision. Okay. Last but not least, as we're finishing up this section of the information session, I don't believe we talked about it, but we do have deadlines, right, for the application. December 1st. And so December 1st by 11:59 p.m. We do know the application is on Eastern Standard Time. So if you submit your application after 9 p.m. Pacific, it will say, hey, congrats, you submitted your application at 1:21 a.m. December 2nd. Don't worry, we know it's still of how we do it is on West Coast time. And so as long as you submit it on December 1st, you're good to go. We do allow what we call submitting accompanying documentations by January 15th. So that means if you submit your application by December 1st, we are going to allow your recommenders until January 15th to submit. And or if there's anything else that we're missing, we will reach out to you and we will ask that you submit that by January 15th. One thing to keep in mind is we do reach out to you. If it's myself, probably mostly, if not, if it's going to be my 2 teammates, we will reach out to you throughout the duration of the application process. So it's not like you're going to submit it and then you're just waiting until February or whatever the case is. So we ensure that we're going to maintain that dialogue with you. Okay, and so the rest of my team is what you're seeing here. We go through the process of applications for all of our programs, from our undergraduate to our graduate program. And so if you wanted to reach out to me, you're going to see my email address here, as well as my 2 teammates. Love to call them each other teammates because we have each other's back when it comes to everything here in the recruitment admissions office. So Jamie Gama, what you're seeing, she's been doing admissions for, I believe, close to 10 years now. And then Natalie Asensio, who's been with us for about 4 years. Let me do, before I continue here. This page you don't necessarily have to worry about, because again, once admitted into our program, we will reach out to you and say, hey, congrats, you've been admitted. Now we need, transcripts from you. We need other documents from you. And we will provide a list of what that information is. We will say, hey, again, if it's an electronic transcript, we have our email that we'll want you to send it to, and or if it's our hard copy, to have it sent here. So again, don't necessarily have to worry about this right now. Okay, so let me take a quick pause before we move into the financial aid section, just to see if anyone has any questions about the application. If there's any confusions or anything like that, please let me see how I can help. Yes, Martha, go ahead.
I have two questions. One, I might have missed this, but are the letters of recommendation due on December 1st or January 15th?
That is a great question. So application due December 1st. The last date to have your recommendations will be January 15th.
Okay.
They can be submitted December 1st. Cool, fine. But definitely the last date would be January 15th.
And then my second question is that I saw something online about presenting evidence of like a nursing scholarly paper.
Yes. Okay, so the reason why I guess we don't necessarily put it as part of like the application process is maybe I should, but okay, let me just say yes. So there is what they call is like a writing sample. And so if you have anything that you believe is probably like your best work, academic work in terms of a paper, a thesis, comp exam, wherever the case is, that's what you would upload into that part of the application. Basically, it's so our faculty can kind of see your writing, ability and things like that. But it would just be any work.
Sorry, can we use our comp exam from like the mentoring program?
Yeah.
Okay.
Yes, you can. Yeah. So any of your work. And so you'll be able to upload it there. And yes, Tran.
Hey, Mark. I'm actually a prospective student, and I'm a few years out before actually applying to the PhD. My question is, in terms of like being in state, is it because if you go out of state and it's a 4-year program from a cost perspective, how does that get? I don't know if we covered that yet, the tuition cost.
Yeah, great question. So we're gonna go over that next. When I say we're, it's actually going to be Leonie Thomas. She's our director of financial aid. I'm going to play a quick video that she has. Off the top of my head, I don't remember if she talks much about out of state tuition. She might, but if not, then we can circle back to answer that. But we're going to play that video shortly.
All right. And then the second question I have is, I was looking at the different chairs of which year do we decide on?
Wait. Oh, go ahead, Jen. Something came through. Go ahead. Jen, can you hear us? Go ahead. I think you're muted though. Oh wait, hold on. Wait a minute.
Okay.
There we go.
Thank you, Mark.
Yeah.
The second question I have is, when do I determine which chair?
Yes, good question. So, two things, and I know our faculty will probably talk about that. When you are offered admission into the program, you will at that time be given a faculty mentor or a faculty advisor, I should say. Now that faculty advisor will move through at least the first 2 years of the program. And then it's when year 3 starts, after you pass your oral exam, that's when you're going to be able to select your chair. And so your chair could also be your faculty advisor who you've been working with throughout the first couple of years, or you could select someone different. But your advisor will talk you and move you through that process of selecting your chair. But it happens once you're already in the program and after you complete your first couple of years. Cool. Okay.
Hey, Mark.
Yes.
The research methods course that we took in the Meccan program, would that still count for our research course for prerequisite for admission?
Say that one, you said the research course? Yes, it would. Yes, yes. That graduate or level research course that you have completed, yes, it would.
Great, thank you.
So I know that would work for you as well as Martha, so that would be fine.
And then Mark, can I ask another question real quick?
Sure.
So I know that you know, you're talking about the personal statement and like voicing your interest in your research area and that kind of stuff. How heavily is having former research experience like at the college level weighted? And does that depend kind of more on what you want to do with your PhD? Like if you want to do more academia, is that more, I'm kind of curious about the research component of that as a prerequisite.
Yeah, it's a great question. And we're also going to propose that to our faculty too, just to see what their thoughts are. But it does depend on what you want to do with your doctorate degree. So you don't necessarily have to have any research or tons of research. It just depends on what you want to do with it. But the easiest way of going about it is if you do have some, it would just be easier to articulate yourself in terms of this is the pathway of where I want to go. And it's based off what I've done thus far. So it does depend, but let's wait and let's also ask our faculty just to see what their thoughts are, because they've all gone through different paths in terms of why they've gotten their doctorate degree and what type of research they're doing now. But don't think if you don't have a lot, especially because you just graduated, right? Didn't you?
Yeah, last year.
Yeah. So yeah, you don't necessarily have to have a lot. I'm not sure if you ever piggyback throughout your years with any research with our faculty members, like maybe something like that could be something you can include in your application and whatnot. So once that panel comes to get about, we're going to have more of a discussion in terms of, what we're all doing.
Great. Thank you.
Yeah. Okay, so let me do a new share. And I'm going to play this recording that Leonie put together for us.
Hi, everyone. My name is Leonie. I'm the Director of Financial Aid at the School of Nursing. Welcome to our PhD information session. I'm so glad you have joined us. In this presentation, I will be sharing an overview of financial aid at the School of Nursing. But if you have any specific questions, please feel free to reach out to us at financialaid@sonnet.ucla.edu. In this session, we'll be going over a few topics, including annual student fees for the PhD program, the cost of attendance, how to fund your education using fellowships, federal financial aid, and other sources of support, and important dates to keep in mind. Let's begin by reviewing the annual student fees. So student fees include UC-wide and campus-based fees. You'll see in the table here the fee categories and the annual fee charges, as well as the quarterly fee charges. You will pay your tuition on a quarterly basis. Your tuition and fees for the year are $13,321. Health insurance is an annual fee of $4,713. It is mandatory that our students have health insurance coverage. However, you can choose to waive the UC-SHIP health insurance requirements and fees if you already have adequate insurance coverage. There's also a one-time document fee of $100. That means your annual tuition and fees are $18,134, or about $6,011 per quarter. If you are a non-resident, there is a non-resident supplemental tuition fee of $15,102 annually. Current fees for the doctorate program can be found by navigating to registrar.ucla.edu, hovering over fees and residence, and selecting annual and term student fees from the dropdown. You can there specify the academic year, term, and degree on the dropdown menus. The cost of attendance, or COA for short, is an allowance based on educational expenses that students might incur. It includes direct and indirect costs, and it is also the maximum amount of financial aid that students can receive during an enrollment period. You will see in the pie chart the different components of the cost of attendance. The total projected budget for our doctoral program is currently $48,587. Doctoral students can fund their education in a combination of ways, one of which is through fellowships. We offer a university fellowship to each of our entering students, and this covers the full tuition and fees plus health insurance during the first year in the program. On your admissions application, you'll also have the opportunity to apply for multiple graduate division fellowships, including the Eugene Cota-Robles Fellowship, which is a 4-year renewable fellowship that pays for your full tuition and fees, plus students receive a $25,000 annual stipend. The deadline to apply for fellowship is December 1st, 2022. Students can also apply for federal financial aid. The financial aid application opens up on October 1st each year with a priority date of March 2nd. When applying for federal financial aid through the FAFSA, we can offer a direct unsubsidized loan up to $20,500 annually and a Graduate Plus loan up to the cost of attendance. Please note the Graduate Plus loan is a credit-based loan. You can apply for financial aid on studentaid.gov. Other sources of support utilized by our students are through academic apprentice personnel titles. Students holding academic apprentice personnel titles may qualify for fee remissions, which covers approximately 95% of your in-state tuition and fee assessments. That includes 100% of your health insurance, 100% of tuition, and 100% of the student services fee. Students also receive a quarterly stipend of at least $3,800 per quarter. Fee remissions and stipend benefits through academic apprentice personnel titles equates to approximately $29,489 in annual support. Just in case we have any UC employees here, there's also the UC Employee Reduced Fee Program. Eligible regular status UC employees may qualify for a 2/3 tuition reduction in the student services and tuition fees. That equates to approximately $8,568 in annual financial support. Now I just want to highlight some important dates. As mentioned, the financial aid application opens on October 1st. So be sure to file your FAFSA if you'd like to receive federal aid. December 1st is our graduate fellowship application deadline. March 2nd is the financial aid application priority deadline. And typically around March or April is when graduate division fellowship award notifications are released to recipients. In August, we release the university fellowship award notifications. You can find more information about financial aid at the School of Nursing on our website at nursing.ucla.edu/financial-aid. And you can find more information about graduate division fellowships at grad.ucla.edu. Or feel free to email me your specific questions at financialaid@sonnet.ucla.edu. Thanks for listening.
Right. Let me get back to our new share. Oh, there we go. Okay. So is there any quick questions about the financial aid scholarship portion after reviewing the video? Okay, let's also remember too, Leonie is a great person to reach out to if you guys have any specific questions. She can, assess what it may look like for next year, but definitely once you apply and admit into the program, that's where it really starts on her end. Once you are submitting your FAFSA, then she's able to receive your information and really be able to give you an estimate in terms of, again, what it would look like for the scholarships that you can receive, loans, and or paying out of pocket if that's the case. And so she's been amazing on that. But I do want to make sure that you guys do have the opportunity to reach out to her. But I do see our esteemed faculty are joining us. And so let me I see, okay, Dr. Chen, Dr. Devon, I see Dr. Robbins, Dr. Salem. Okay, I'm gonna leave this. Oh, sorry.
You're gonna leave us?
No, sorry. No, I'm still gonna be here. I was gonna say, I just want to leave this slide up just for another minute or so, or seconds, if people want to take a screenshot just of their titles and or email address. But then what I'm gonna do is I'm gonna unshare, that way we can have a bigger kind of picture and we can kind of make it as if we're having a roundtable type of discussion. So I'll leave this up here for maybe 10 more seconds. 10, 9, 8. And then we'll go from there. And hopefully Dr. Hodge will be joining us shortly as well.
Okay. We were going to start with Holly when we start.
Yeah. Okay. Okay. So where are you, Holly? There she is. Okay. So Dr. Devon has done this plenty of times. She's been amazing. She's always so gracious enough to join us during our PhD information sessions, especially our faculty research panel. But just to start it off, Dr. Devon, of course, introducing yourself, letting us know your educational background, in the sense of what got you and led you to wanting to get your doctorate degree. And then we'll maybe pause there and we'll move around. Oh, and then what your research is, of course. And then we'll just move around our faculty panel, saying and offering the same things. And then what we'll do is we'll kind of open it up to our attendees to see if they have any questions, and we'll just kind of have a dialogue and discussion from there. But I'll let you take over, Dr. Devon.
Thank you so much, Mark. Well, welcome everybody. It's so great to see that you have an interest in the PhD program. So I have to start my remarks by talking about mentorship, because Mark said, tell us how you came to decide to get a PhD in nursing science. And I had a master's degree. I was a cardiovascular clinical specialist, but when I was in a science-based master's program, not an MSN, so I had to do original research. And I had a fantastic mentor who encouraged me at every turn and tried to get me to stay on and go directly into the PhD program. But I had a newborn when I went into the program, and I was expecting when I graduated. So she literally was on me every year for 15 years until I enrolled in the PhD program. And I didn't have a clear path when I entered the program, other than I am a lifelong learner and I really enjoy learning. And I always loved critical care. I started out as an ICU nurse. My first love is cardiac patients. I knew I wanted to do clinical research that involved cardiac patients. And so I went into the program, and I was so fortunate that the person who became my chair and mentor in the PhD program was newly funded on a grant, and I went to work for her as an RA and worked for her for 3 years until I got an F31 of my own. And NIH only allows you to be 100%, not over 100%. And so as I said, I knew I wanted to study cardiac patients. She was doing a study on the influence of bystanders for patients having MI symptoms. So I began the study of sex differences in symptoms for patients with acute coronary syndrome. And of course, we have a plan, and we don't yet know our results, and we don't know what's going to happen. And so based on my results, I began to study ethnic and racial disparities in my patient population. I was always interested in measurement. I began studying symptom clusters. And then in a big study I did in emergency departments across the country, I found somewhat unexpectedly that following patients who had been hospitalized for ACS, acute coronary syndrome, 33% of them were still symptomatic, having anginal symptoms 6 months after discharge. And so that led me to a study that we are about to launch that was just funded by NINR, a randomized clinical trial of acupuncture for chest pain syndrome, for angina. Because all of our patients had been discharged from major medical centers and they were receiving guideline-directed therapy, but it wasn't sufficient to mitigate their symptoms. So it's a very exciting time. Some of you may know something about complementary and integrative healthcare, and things like acupuncture are being more and more accepted by both patients and clinicians. So I think I've told you a lot. I don't want to take up too much time, but Mark, do you want me to take questions or wait till the end?
Yeah, will you be able to stay with us until the end?
I actually should tell everybody that in a few minutes, I have a PhD student doing her oral qualifying exam. So I can't stay until the end, but if anybody has a question, I'm happy. I will say one caveat. It was hard work. And my smart mentor said to me during my interview, "What are you willing to give up to be successful in this program?" And sadly, I did give up tennis, which I played on a team at the time. But I never regretted it. I just love research, and it's been a wonderful career, and now having the opportunity to mentor students. So thank you.
So, and while maybe some people might be thinking of some questions, if you can maybe leave us with some advice about pursuing it. Yeah.
I would say take advantage of every opportunity when you are in the program, because you will have all of us taking care of you, supporting you, giving you advice. And the beauty of an academic environment is we all have different experiences. And so we can help in many ways. So I would say time management will be of the essence, but it's temporary. And even on the hardest days, you can see the light at the end of the tunnel. Thank you. Thanks for inviting me, Mark and Dr. Robbins.
Oh, thank you, Holly.
I wish you all the very best.
Thanks again for joining us.
Thank you.
All right. So I see next I'll see.
Oh, there's a hand up.
Oh, yes, there's a hand. So Tran, sorry. Yes. Oh, wait. Let me see if you're muted. Let me see if I can unmute you or.
It was a clap.
Oh, it was a clap. Ah, awesome. Cool, cool. Thank you. Okay, so I see just how it is looking on my screen. Dr. Salem, would you want to go next?
Sure. Good afternoon, everybody. Thank you so much, Dr. Robbins and Mark, for inviting me. My name is Vanessa Salem. I am an associate adjunct professor in the School of Nursing, and I'm really pleased to be able to share with you my trajectory and some of the things that have driven me to pursue a doctorate, but also continue working with a population that I actually started working with during my doctoral studies. So I am a community-based nurse scientist and academician. I've had a commitment, passion, and drive to reduce health disparities among people experiencing homelessness and underserved communities. I actually have a direct entry experience because I started as a Meccan student, and I'm essentially during my master's program completed the Meccan program and thereafter applied to the doctorate program in nursing science. And I started the doctorate program very quickly after I completed my master's degree. During my master's degree, I was introduced to actually research approaches and developing a literature review, and through the comprehensive exam experience and my public health rotation, I was really inspired to utilize data and to essentially work with data and gather data that would make an impact, especially with underserved communities. And so I felt very strongly about pursuing a doctorate while I was at UCLA, and many of my experiences inspired me to continue in that path. In my research, I've used mixed methods approaches and community participatory research principles to develop, implement, and evaluate interventions with this community, in particular people experiencing homelessness. I previously completed a National Institute of Nursing Research T32 Health Disparities pre- and postdoctoral fellowship. Actually, one of my mentors is here on the call, Dr. Felicia Hodge. Hi, Dr. Hodge. And previously, I also completed a Bachelor of Science in Health Promotion and Disease Prevention Studies with a minor in News Media and Society from the University of Southern California. And I'm a double Bruin. I have both my master's and PhD in nursing from UCLA. So a little bit about my dissertation research. My dissertation research laid the foundation for me to actually design and establish a theoretical basis for understanding frailty among underserved communities. And I was also able to test the theory that I developed through my dissertation. This scholarly work allowed me also to identify correlates or associations of frailty with middle-aged and older people experiencing homelessness. This significantly assisted me as I moved forward with my postdoctoral fellowship. So building from my predoctoral research and my postdoctoral research, I utilized qualitative and quantitative methods to understand barriers and facilitators experienced by pre-frail and frail middle-aged and older women experiencing homelessness who were navigating multiple systems. And I also worked with homeless service providers, which informed the development of a community-based intervention that was tailored for this community. So in this study, I compared the effectiveness of a frailty intervention compared to a health promotion program for this population. And afterwards, I completed a 3-phase mixed method study that enrolled 120 middle-aged and older women experiencing homelessness in a cross-sectional study in Skid Row. And we also established a diverse community advisory board, which was composed of formerly homeless women, community health workers, and community-based site liaisons, where we met for 6 months to review 2 separate curriculum. Those 2 separate curriculum led to an enhanced program called Healthy Beginnings, which was developed and further refined based on community and academic partner feedback. And then we held focus groups, which assessed preliminary acceptability of the program. So my most recent study has been funded by the Hillman Foundation, and it's a pilot feasibility trial of this intervention with this population. It's a single-arm study, and it's a stage 1B study. And it aims to enroll middle-aged and older women experiencing homelessness in the intervention. And we will also qualitatively evaluate in post-intervention focus groups their thoughts and ideas related to the program. So I am so pleased to share with you my trajectory. I know that was a lot of information, but I am more than happy to entertain any questions throughout this time we have today. Thank you.
Awesome. Thank you so much. So will you be sticking with us for the duration of it?
Yes, Mark, I'll be here the entire time.
Okay, awesome. So yeah, we'll just go around if we can, and then we'll be able to open it up that way. So next I see Dr. Wei Ti Chen.
Hi, seems there is no assistant professor today. Then I was pretending I'm the assistant today as listed as assistant. I am graduated a long time ago from Columbia, and at the time I was also I am also trained as a nurse midwife. So the studies I want to do is really related to women's health instead of pregnancy, because pregnancy is taking 9 months to have the outcome. So I have no patient to wait. So I decided to go for breast cancer prevention. And that was back a long time ago. So I did a studies on immigrants and then how they perceive the knowledge and attitude and behavior of breast cancer and mammograms and cervical cancer practice. And then right before I graduated, my advisor, Sue Buchan, then called me into the room and she said, wait till give you 3 days to think about whether you want to do something about HIV. I'm kind of, huh? HIV? Midwife and HIV are not really related. But I went home and 3 days later, I told her, I still cannot find a connection. And she said, well, just because you don't know. So that is why you need to do it. So I end up at UCSF working on HIV postdoc and focuses on global health. At that time, my advisor, who now already finally retired as a beer hostmer, now is 80 something, and working on the Africa project is about HIV stigma reductions. So I started my project as working in China at that time, back in early 2000s, that the HIV is really not widely discussed. So I accomplished a series of HIV stigma and then how they how are their coping strategy, especially focuses on HIV positive women living in China and their self and family management. And time fast forward, then because the projects that we are expanding, we also doing the HIV positive individual in Asian American background currently in Los Angeles and in New York City. At the same time, we also have a big global health component doing people living with AIDS living with HIV in Myanmar and in Thailand, and we are planning to start another site in Indonesia. So, any question for me?
Awesome. Thank you so much. And then we'll move on to Dr. Felicia Hodge.
Thank you. Thank you for inviting me here today. I started my research really quite a while ago. And really in the 1980s, we received a notice from NIH that was the first time that they acknowledged American Indians and would allow some funding to be available to study American Indians. And I was particularly interested in it because my mother's American Indian, my father's Norwegian, and I always followed the work and the community activism that she did. And so I put in a proposal for smoking cessation. I was uncomfortable because I was a smoker and I got caught at smoking at one of these events. Yes, I was up on the stage and someone said, Dr. Hodge, do you smoke? I was like, what? What was the question? I had to quit. And I'm glad I did. But that was one of the first studies ever done on American Indians. And we went out and we did one of the things that I learned now not to do. We invited 15 American Indian clinics in California to join it. And we put everything but the kitchen sink in there. And it was a big study. And I should have whittled down the sites. But nonetheless, we had a big study. We had an N of a little over 500. And we found out that over 55% of the population smoked cigarettes. And so then the dilemma was, what is the message are you going to give to them to quit smoking? And investigating more, we found out that reservation tribes sold cigarettes for $1 each on the reservation, mainly because if it was sold on the reservation, they don't have to pay taxes, get their cigarettes from Canada, across the river. So we found out much more, and I started getting real interested in qualitative research. So after that study that really took over 7 years, tribes started asking us more to look at areas of cancer in cervical and breast cancer and start with helping some of the communities to get screened. And so qualitative research then became a big issue for me. And I must say at that time, after I finished my dissertation, it was not well accepted. And so it was real difficult to pull that into projects. Now, mixed methods is certainly accepted. In fact, I think it is required most of our studies require that at the very beginning, because with over 576 tribes in the United States that all speak a different language and all have different values and beliefs, you cannot design a study that would be generalizable to all tribes. So we have to use and walk into this with qualitative studies to better understand it. So some of the projects we did is we looked at nutrition, we looked at screening behaviors for cancer. We did a very big study with the Sioux tribes, in North and South Dakota. We had 4 large tribes there that invited me up there to take a look at diabetes. And we found out some interesting things. Is they were non-compliant. Why? Because diabetes doesn't hurt me. You know, I don't see it the next day. I don't understand it. And we also found out they were not taking their high blood pressure pills for the same reason. They didn't understand it, didn't see a response right away. So we designed a study where groups of them came in. We took their height and weight, and we took their blood pressure, and we had something called a Futrix machine where you put it on your arm and it'll tell you the fat component, which your body weight mass is. And it prints out a little, like a receipt, like a grocery store receipt. And we could show it to them so that each time they came in, their goal was to reduce it. Now it gets pretty hot in the summer there, cold in the winter, but very hot. Almost all of them were dehydrated. But one of the important lessons I learned there was to allow them to also educate the researchers, because the elders came in and said, you know, we have this, we can help you. We can tell you why people, you know, are not being compliant. Not only did the elders help us, but from then on, wherever I did my research on American Indian reservations, we always had the nurses help us. Why? Because they work in the community trusts them, respect for them, look up for them, go to them, and we can help. They can help us to do outreach and pull together the studies. And that one big study was just so successful. They still use, plus I got the chairman to quit smoking. And so that was an after effect that was important. More recently, we started to look at cancer again. And in the Southwest in Arizona, we looked at cancer pain and depression, loss of function and fatigue, and found out interesting things. People reported to us that they do not view pain the way the rest of the population does. So how do you elicit that information from them? Yes, it was a randomized trial that we did, as clinical trial. We did this for almost 12 years. But so at the very beginning, we did qualitative research. We had actually 13 focus groups because we were looking at pain, depression, fatigue, and loss of function. With pain, the terminology for that, the reasons for that was important, and how they viewed it. And I have to tell you something, this happened without even our knowledge. They decided to put their heads together and they started drawing pictures of pain. Now we published that if you want to take a look at it. But that is how they wanted to illustrate their pain to us so we would better understand what pain meant to them. Now, are they compliant or adherent and taking pain medication? No. Why? And we worked into that. It was because they feared addiction. They felt that pain was meant to be. There was always sorrow in the world, and that they were strong enough to bear the pain, and they had a different cultural constructs with it. Now, we were able to go in also and make some impacts. For instance, there are 6 big Indian hospitals in the United States. One is in Phoenix, the Phoenix Indian Medical Center. So I was in there one day pulling together some interviews and talking to the pharmacist, and I noticed that she was greeting some of the older patients and she was giving them little baggies. And I said, what's in there? And she said, oxycodone. And I mean to tell you, a baggie. And I said, oh, fun. How much is that? And she said, well, we probably won't see them for 6 or 8 months. So I'm giving them that amount so they don't have to come in from distant places. And I said, are you aware that grandsons are waiting outside to give grandma a lift home and is taking that baggie? And they were saying, no, they hadn't even considered that this is what was happening. So we were able to kind of put a stop to that and better understand some of the problems that was having with communication and what have you. We were also able to ask them to institute some reviews with peers and other people who could come in and talk to patients, because a lot of providers seemed to feel that patients would not know that much about cancer. So there was no need to talk to them about cancer. And so we did a big educational program with them on that. We're still publishing. Now, the last study that we are starting now is with Agent Orange. You maybe heard about Agent Orange in Vietnam. Agent Orange is an herbicide, and it is used to defoil the forest so that the forest trees will, be gone. They'll kill all the forest so that when there was war going on with the United States and Vietnam, that all the forest areas would be gone. Well, Los Angeles and San Francisco was saying, we need more water, as they always say. We want more water to come down here. So they picked Gila River as one of the rivers that come down and come into the Colorado River, that we drink that water, part of it. And so they were concerned that there were cottonwood trees there they had to do something about, without telling the tribe or anybody else, because the San Carlos Apache Reservation is right on the water. They went through there with little planes and sprayed the hell out of the whole area, up and down the river, around the town. And the elders and this was 1969, the elders tell me that they were outside at recess and they said, there were rainbows coming down from the sky. And I said, rainbows? And what happened is, it gets to be 106, 110 there in Apache Reservation. And so that water wouldn't dissipate, they mixed the Agent Orange herbicide with gasoline. And so when they spread it out in the sky from the airplane to let it come down, the sun would reflect off the gasoline and make it look like rainbows coming down. Well, no one knew what this was, and little kids were going out there, and it was all over their clothes during recess, and the whole town had it and what have you. And then they couldn't understand why there were enormous acreages that even now is roped off. It's contaminated. You can't touch it. You can't put your foot on it. And the federal government would not admit to it, would not do any studies, did not stop it. The water is so contaminated right now. They had 7 wells, and I met with EPA a couple of years ago to say, what's happening with the water? And they said, well, 7 wells, we capped 5 of them. We left 2 of them open for the community to drink. And I said, would you drink that water? And they said, no, highly contaminated. Will they tell the community? No. So what I tell you is investigative research is just so interesting, but what you need to do is learn the tools, not only so that you can ask the right question and do some investigation with qualitative research, but how to do measurements and look at outcome. So both of them married together is very important to learn. So when you come to school and you take these classes, and yes, you're going to have to bear through statistics and what have you, but learn these tools because you will use them throughout your research. And don't be afraid of them. And don't be afraid to pick a topic for your dissertation and halfway through say, I'm going to pick something else. That's what I did when I was getting my dissertation. I thought, hell with that old stuff. I'm getting some new stuff done. So this is your time to learn. These are your tools to acquire. And we look forward to all of you being a part of our family here.
Awesome. Thank you so much, Dr. Hodge. That was amazing. I appreciate that. We'll follow that up with Dr. Robbins. Would you want to talk about how you got to your seat? And then we'll open it up for everyone.
I just came back to visit
Okay.
and listen to the others. Maybe if we do questions now, and if there's a little time left, then I'll use it.
Yeah. Of course. So I want to leave this floor open to our attendees to see if we have any questions that you would love for our faculty to help answer for you. Yes, Tran.
My question is, when you identified your chair, and there's other folks part of your committee, if you will, can you elaborate how you identify the supportive team?
I'm more than happy to answer that. In my seminar, I do take the doctoral students through a session of identifying the team. And I say to them, don't pick the first person to be your chair and other people to be on their committee, because a couple of months down the road, you're going to say, I want different people on here. What do I do? How do I go and tell them, forget it, I made a mistake, I don't want you on my committee anymore? So I said, first of all, go around and interview them, make appointments to interview people. Your chair is the one that's going to work with you throughout the sessions, get you through the process. And generally, I tell them, if the chair is happy with what you do, your committee will probably also be happy. But you want to pick a chair that you know and you like, and you've taken classes from them. So for instance, if you're doing something in environmental health, pick a chair that's in that area. If you're doing something in maternal child health, pick somebody who is well versed in that area. And then once you have selected a chair after interviewing other people, sit down with them and say, who should my committee be? Should I have a statistician on my committee? Should I have somebody in evaluation or quantitative research? Who else should make up this 4-member team? And you do not have to pick your committee until, let's see now, Wendy, what is it, the end of the second year? So I'm going towards there.
Well, some people are ready at the beginning of their second year, but a lot of students are ready sometime during that second year.
From the first to the second year, you start interviewing people and thinking about what your committee looks like. Now, even if you go through the process and you pass your oral exams and you say, you know, I need someone else, or someone leaves employment and goes something happens, you can reconstitute your committee. Takes a bunch of signatures and what have you. The committee is there to help you, and you've got to get along with your chair. If something happens and you don't get along with them, change it. No one's going to say anything. No one's going to cry tears. Change your committee if you have to, but they're the ones who are going to work with you to go through this. So your chair should help you identify your other committee members.
Awesome. Thank you so much. I also see Martha has her hand up.
Hi, thank you everyone for sharing about your research with us. And I kind of have a general question about how you incorporate PhD students into your work, or kind of like what role does a PhD student take? I know that like a 2-3 years of really intense research as a student, it's not enough to go from like study design to publication necessarily. So I was wondering, like, how much do students piggyback off of studies that are already going on, or like other people's research?
Yeah, I can start, and I know Felicia does really well with students in this area. So it's good to have a research group. So several of the faculty have multiple PhD students, and they have a research group, and that group meets together. And when these kinds of things happen, you learn from the other students and you move forward. And usually this kind of a setup will lead to publications even before, you graduate, or presenting posters even before you would have expected to. But it is helpful to do that. Now, if you have a lab, if you're lab-based, that seems to be a little bit more obvious how it works. You work in the lab so many hours, and you work on experiments to get to know how to do it. And then you incorporate your research area that way. It's a little less straightforward sometimes with other kinds of studies. Yeah, so I don't know. Vanessa or Wee-T, you want to talk about how you manage this?
Well, I think that's a great question. Thank you, Wendy, for sharing some of that insight. I think as a student, it's helpful to be involved in faculty research. It gives you an opportunity to learn new skills, to strengthen your skills, and then to apply it to your dissertation. So what I would say is that you should look at the faculty roster and take a look at the different content areas and the expertise, and Similar to what Felicia said about interviewing faculty, there's always an opportunity for you to reach out and interview faculty and ask them if they have any opportunities, if they have any active studies. Just because a study isn't currently recruiting doesn't necessarily mean that you can't take on a role. For example, you can take on a role as part of a writing group and learn new writing skills. You can participate in dissemination, which is oftentimes the last part. And maybe if it's in its early stages, you can work on even a grant submission. So all of these opportunities are valuable and will help set the stage for you to move forward. So as a student myself, I had the opportunity to work on a number of different studies that was in addition to my own. And I learned a lot of skills from qualitative and quantitative skills that were really valuable for me. And I always knocked on faculty doors to ask what I could get involved in. And it wasn't necessarily that it was always a paid experience. Sometimes I volunteered to participate because I felt that it was valuable enough for me to learn new skills. And I really cared about the work and what they were doing. I really wanted to make a difference. So think about how you want to spend your time at UCLA. I think that's really important. And it's a very unique time for you. I think that when you graduate and move on, it's quite different. And so take the opportunity and hone new skills while you're at UCLA.
Yeah, I just want to share that you want to get your degree in a short time. You don't want to start a project that forever stuck right here. So don't think about a big projects that if you can work with your advisor or any of your research committees, even though ongoing projects that you can have your own smaller scales of the study, that it's good enough. You don't need to recreate a brand new thing and then super hard to collect data, and then you won't be able to finish within the time frames that you want to. So your committee members or your chair will tell you a little bit more when you come in. Yeah.
And Felicia, you're really good at this, getting the students involved in your research.
Well, I don't necessarily get them involved in my primary research as far as going out in the field, because I need to get prior permission from the tribes as far as who's going to be involved, and also with the NIH, because tribes have their own IRB, so we have to follow their protocol. But I do get students involved in publication of the papers, analysis of the data, discussing through what are the findings, what are we seeing here, and also helping to develop some posters and going out and around to help present the posters and some of the findings. And so many of the students are interested in vulnerable populations globally. So something like pain, one student came to me and said she's interested in elderly Japanese and the whole topic of pain and how you measure it. And would you come up with a new acculturation scale or a new pain scale? Because no one likes that little smiley face. I mean, everybody just laughs at that little scale. It's, and to tell you the truth, the Indian Health Service came out with one that they said was culturally appropriate, and all they did was put a feather on it on the head. And I said, this is really sick. This does nothing for the scale. But anyway, we do allow students or encourage them to be involved, and they have fun in publishing it and putting together the poster. Plus, they all want to go to, to Utah, to even locally to some conferences and help present the poster. So when we can involve the students. But I do agree with Benisa. You do not want to have a dissertation that is so difficult and complex. It's going to take years, because I don't think students can stay here longer than 10 years. So they expect you the first year take classes, second year take classes, be ready for your oral exams at the end of the second year. If you're approved, then you jump into your dissertation. That may take 2-3 years. Then out you go. So, it can go by fast, and you've got to kind of figure out what you're doing and pick a topic, pick something you can do that's doable, and that's not going to cost a whole bunch of money. So you can think about that.
Awesome. Thank you. So we'll move on. I see Charlotte has her hand up.
Yes, thank you, Mark. So I had actually asked this question earlier, and then Mark encouraged me to ask it again when you guys were all here. So My question is more about when you're considering, people participating in the PhD program, how kind of heavily you consider their prior research experience, and whether that's influenced about, what they want to do with the PhD, whether they're more academic focused or research focused. Basically, in seeing people come in, do you want them to have prior research experience, or is it kind of either way? Is that an individual preference? Could any of you speak a little bit more to that?
Well, I can comment about my experience on the selection committees. And you can have a student who comes in and has no research experience other than taking what is that 204 nursing research? I don't know what the name of the class is anymore, but you've had research coursework, but not had research experience. However, the rest of the application is just, really motivating. And you say that student would blossom with some experience here, with some of the people that we have here. So that would be, one scenario. Other scenarios, students will, applicants, you'll see in their application materials that they've already published, and they have research papers already, and that is also something that's taken into consideration. But it's not like, oh no research experience, go to this pile. It's not like that at all. It's the whole application piece, and it's very compelling if you read an application where the student tells you why they're interested in research and the particular area of interest that they have. And I'll turn it over to the others.
I think even though you might have experience in research when you come to the doctoral program at UCLA, you're still going to take statistics. You're still going to learn a lot in that. You're going to take other measures. You're going to take things that you have not been introduced to. And research changes very fast. It really does. When I was going to school, IRB didn't exist. Now it does. It's very difficult to fill out the application forms and get that through. So you will, somebody who's really quite experienced or has done some research in the past, it'll benefit them so that they will understand they need a whole selection of tools in their toolkit. And there's a lot more to learn. There's really quite a bit more to learn in the area of research. And there's research writing, and there's all kinds of data analysis and all kinds of computerized programs and all. But if I review an application, I don't say, well, look at this person has more experience than others. We look, holistically at the person, see what their interest is, maybe service, maybe they've, done things overseas, or they've done other types of projects, or even some of the classes they've taken, or maybe they've helped teach or something. So we look totally at an applicant.
All right, we have our faculty here. Don't be shy if you have any questions. We have the direct sources right here. So we'll still leave it open for a few more minutes. Yes, go ahead, Tran.
Sorry, it's really loud here. When I consider looking at a topic, technology such as machine learning and AI is very ubiquitous. So when we select something, is it more of a conduit, or do we need to focus more disease or group?
Between you and your chair, really, what do you think, Wendy?
Oh, I think no, you don't need to focus on disease. You need to focus. What are you interested in? You can focus on what you're interested in, and we have faculty here in who do AI and large data sets, and their questions are different. Sometimes they're focused on disease, but sometimes they're not. Sometimes they're focused on policy or change or at a systems level. So, it doesn't need to be focused on disease. My research focuses on risk. I mean, and it doesn't necessarily equate with counting disease, numbers of cases of disease. So yeah, no, everything that you want to bring is valuable. So,
and a lot of my research focuses on racism and taking a look at that. Also, I always recommend to students, when you get to UCLA, think about taking classes outside of the School of Nursing. You can take classes all across campus. You can sit in on them and not even sign up if you get the permission of the teacher. You can take summer classes. You can take night classes. This is the only time that you're going to be able to take classes like that. Once you graduate and gone, you're gone, So while you're here, take advantage of everything that UCLA offers.
That's great. Thank you.
Take some theater classes.
yeah, Vanessa, would your research now currently doesn't have as the outcome, is it disease or is it predictors of homelessness and overall? Yeah.
Well, the study itself, the one that's been funded, is a pilot feasibility trial. So we're looking at, the feasibility of actually implementing the intervention. However, some of the outcomes are potentially chronic disease self-care. So it's actually, I think to say it's condition focused is not accurate, because it's actually focused on multiple conditions, because the population experiences multiple physical and mental health conditions that are co-occurring. But I mean, Tran, you have a good point. I think that use of AI in healthcare is really expanding. It's a really innovative area. I think you could look at it with a lot of different perspectives and maybe decide on a condition. You may need to decide on a condition of the use of AI, but you can decide on that later on with your chair, of course.
Okay, go ahead, Martha.
I was wondering if PhD students, if many of them who are clinical nurses continue working part-time during the program, and also like as faculty members, what you all do in terms of clinical practice.
So I would say the majority of our students start out still working, and that we try to adapt the program to that kind of a situation. For example, as much as we can offer in a remote manner, we try to do that, and then we try to schedule courses all on the same day. And then you would know that ahead of time, that your courses are going to be on Thursdays. Thursday, you can plan your schedule around that. So we try to accommodate that. Some of the the funding that comes in can help you reduce your work hours, because you have something paying your tuition, and you heard from Leonie about opportunities for funding. I don't know, do others have things to add here?
Well, they might be surprised that several of us are not nurses. I'm not a nurse. I got my degree in public health. We have 3 or 4 other faculty who are not nurses. One's a pharmacist, one's in engineering. So many of the departments hire people with different skills, and they don't have to have that degree in that department. I have a joint appointment in public health. Several of our faculty have joint appointments in medicine. And so, you know, we bring a lot to the school. So you probably don't have to worry about that.
All right. Thank you. I see, yeah, some people are starting to drop off. And that's just because we went over time, but that's amazing. That just means we've been having great discussion. And so I just want to say thank you, everyone. If I could just spend maybe another minute or two, if I can ask our faculty maybe to leave like one piece of advice, then we can conclude our session that way. I think it'd be a good kind of lasting leaving mark for everyone to think about before we head out.
I would say enjoy yourself while you're a student at UCLA School of Nursing, but make sure that you learn those tools that you need to have in your toolbox.
Well, it's hard to pinpoint one piece of advice. I think for me, I'm excited that you all are here and interested in pursuing a doctorate. I think it's a really exciting time, and you should continue knocking on doors and really strongly considering your next steps. And that is, in your application and your statement of intent. And just realize that it's more of a marathon. The doctoral education is more of a marathon, and you have to really decide on something that you are passionate about and that will sustain you. And that's a really good place to begin. So when you're thinking about a topic and population, think about what type of impact do you want to make in your career, or where do you want to begin? And so I think that for many of us, we did that. The why becomes really important. Why am I doing this? Why am I here? And it sustains you across your career, because a lot of things may happen, and you really have to hold on to that and surround yourself with people who are very positive and will cheer you on all along the way. So if I can be of assistance to any of you, please reach out to me. I'm more than happy to answer any further questions as they come up.
Yeah, I would say take advantage of the resources. Reach out to resources. They'll be really helpful for you. This is a research intensive university, and guess what? They love people who like researcher and want to become researchers. So reach out, don't be afraid. Everybody wants to work with PhD students. It's enriching, and those are resources, from other people on campus, but also don't be afraid to reach out to Leonie in terms of financial resources. I mean, there are resources on campus for writing, there are resources on campus for parents who have come back for their PhD. There are all kinds of resources. So, and your advisor, wow, and then your chair, that resource as well.
Awesome. Thank you so much. Uh-oh, I'm a little slow here. Okay, there we go. So yeah, thank you so much again to Dr. Hodge, Dr. Salem, Dr. Chen, Dr. Devon, as well as Dr. Robbins today. I thought our session went really well. Thank you again for everyone who attended today, spent the last 2 hours with us. You are the ones that we want to see in the future. I can tell by your questions, enthusiasm, and just being here with us that we're gonna, have a great future cohort. So again, just wanted to say thank you. You know how to reach every single one of us. If it has to do with research questions, application questions, but just want to reiterate that we are here with you, and that we hope to see your name and your faces in the future. So without further ado, I'm gonna let us all go, get back to our daily lives, back to work, family, friends, and whatnot. And everyone enjoy yourselves. All right, take care.
Bye-bye.
Bye-bye.